Hey guys, welcome to another session of Veda Victory. This is Nandita Arora, and today we will discuss about a common topic that we all must have experienced sometimes or the other, and that is pain. But before that, don't forget to press that bell icon and subscribe to Veda Victory. Let's start. Whenever you come across a patient with pain as a symptom, here are these 10 questions that I have prepared by which you can analyze the disease and the major causative factor behind that pain. So, before looking to these questions, we should first understand what are the types of pains. So, the first type of pain is superficial pain, second is segmental pain, third is the deep pain, and the fourth is psychogenic pain. So, there are four types of pain. The major thing that is to be kept in mind is in superficial pain. The pain is in the superficial tissues and it is due to the direct irritation of the peripheral nerve endings. Right, now this can be due to any cause: chemical, mechanical, thermal, electrical, and there will be sharp excruciating pain in the case of superficial. Now, second is the segmental pain. In segmental pain, basically, there is irritation in the sensory nerve trunk and the root. Remember, in superficial pain, peripheral nerve endings were involved, and in segmental, sensory nerve endings are involved. Whereas in deep pain, the deep structures of the body, they are involved. The irritation is in the deep structures of the body, like deep fascia, muscles, tendons, bones, viscera, joints. So these are the structures that are involved in deep pain. Whereas in psychogenic pain, that pain arises from the brain and it may be due to emotional distress or any hysterical conditions, or there may be any lesions in the thalamus or hypothalamus or spinothalamic tract. So they are the reasons of psychogenic pain. Now let's move on to our first question, that is the location of the pain. So you have to ask the patient, where is pain localized? Where are you feeling pain? You have to ask this, and according to the answer of the patient, you have to analyze that whether that pain is superficial, is it segmental, is it deep, is it psychogenic. Second question is tip point, that is, you have to ask the patient to point his fingertip at that location. Now, there may be a case that the patient is not able to pin out the location, point out the location. He'll say that यहाँ पेन होती है, कहीं यहाँ पे होती है. Then you have to see that whether he is using his finger, he is using 3 fingers, 4 fingers, or he is using palm. If he is using palm, that means the pain is not localized. He is not sure. He is telling the region. He is telling a particular region. And you have to keep in mind that if the pain is localized in a particular region, then that is basically superficial pain, whereas if it is generalized, that is deep pain. Now, the question number 3 is, what is the origin and the mode of onset of that pain? Whether that pain is acute, whether it is continuous. So, if the pain is due to any recent injury or trauma and that lasts for maximum 6 months, that is categorized as acute pain. But whereas on the other hand, if the pain lasts for more than 6 months and it is constant or intermittent pain, and that pain is referred to as the chronic pain. Then question 4 is, you have to find the nature of the pain. Is it vague? It is throbbing pain? Is it burning pain? Is it pricking needle pain? Is it a shooting pain? And on that basis, you can find the analysis for different things. For example, if anybody is feeling shooting pain in one side of the leg, that may be due to sciatica. Maybe the sciatic nerve is involved in that thing. If a person is feeling burning chest pain, it may be reflex esophagitis or it may be a peptic ulcer. If he is feeling some throbbing pain, it may be a pyogenic abscess. If he is feeling a pricking needle pain, it may be a peripheral nerve injury. If he is feeling a colicky pain, colicky is basically when the muscular wall of a hollow tube like organs in your body is attempting to force that content out of the tube. That is a colicky pain. And these colicky pains are basically intestinal colicky, biliary colicky, ureteric colicky, or appendicular colicky. Now, if a person is feeling colicky pain, so you can analyze according to that condition. If a patient is feeling a constricting type of pain, कोई कुछ दबा रहा है, constrict हो रहा है, that may be an angina pectoris pain, right? So these are the different types, and by this you can find the cause. Now let's move on to the 5th question, that is the progress. Now in this you have to ask the patient, what is the progress of your pain? That is, how much time this pain is there, how much relief is there, how much, after how much gap the pain is again starting. So you have to plot a graph according to his answers. So that will help you to analyze the condition. Question number 6 is the duration of the pain. Now majorly in intestinal colicky pain, it is less than 1 minute. For angina, if the patient rests, if a pain is arising and it is due to angina and the patient takes a rest, then usually in 5 or 6 minutes the pain subsides. But for myocardial infarction or MI cases, the pain do not subsides for hours. So that can be a useful tool for the diagnosis. Question number 7 is the movement of the pain. Now movement of the pain is basically of three types. One is the radiating pain, second is the referred pain, and third is the shifting or migratory pain. So first is the radiating pain, that is the major location that is involved in the pain. वो तो पेन होगी, but उसके साथ the pain will be radiated to some other place also. For example, in duodenal ulcer, suppose there is an ulcer in the duodenum, so that pain will be excruciating towards the posteriorly, towards back, and the patient will also feel a back pain. So that is a radiating pain. Second is the referred pain. Referred pain is basically the major organ which is infected is not paining, that will not pain, but some other part of the body will feel the pain. For example, inflammation in the diaphragm. In the case of inflammation of diaphragm, the shoulder tip, as a nerve that are involved, C3, C4 and C5, they are same in both diaphragm and the shoulder tip, so the pain is referred in that region. But in this case, the diaphragm will not be having any pain. The pain will be only experienced by the shoulder tip. Right. Third is the shifting or migratory pain. Basically, this is seen in appendix patient where the pain starts from the umbilical region, and when that appendix, the visceral and parietal peritoneum of the appendix is also inflamed, then that pain is shifted towards the right iliac region. So that is basically the case of appendicitis. Question number 8 is the time of occurrence. You have to ask the patient, when are you feeling pain? When does the pain occur? If the answer is in the morning, that is कि pain से ही तो मैं उठता हूँ, that means sure shot is it is a case of appendicitis, because in that case the pain is during the morning case. Second is when the patient is feeling pain around 4 to 5 p.m. in the evening and 2 to 3 a.m. in the morning. That may be a case of duodenal ulcers, because in that case the patient experiences hunger pain. So hunger pain is felt in duodenal ulcer. Also, if a patient is coming, like the pain is rising after I wake up, after few hours after rising, the pain is there, that may be a case of frontal sinusitis. And in the case of migraine, the pain will be in the morning, or it may be on the weekends, or it may be, in the case of females, it can be during her menstrual cycle. So that is the cause for that thing. Question number 9 is periodicity. Now you have to ask the patient that what is the periodicity, what is the frequency of that pain. For example, if the pain is there and then it subsides for 1 week and then again that pain comes and then again it subsides for 1 week, if the cycle is repeated again and again, maybe it is a case of peptic ulcer. But whereas if a pain is there and it subsides for a few months, 2-3 months, and then again the pain comes back and then again the cycle repeats, that may be a case of trigeminal neuralgia. So these are some things, some questions by which you can analyze the cause of that pain. And last is the associated features. You have to ask the patient whether he is feeling anything else with that pain, whether he is feeling nausea, vomiting, sweating, or cold extremities. So these are the various associated factors that you have to ask while taking history. For example, in colicky pain, usually the patient with the pain, he experiences sweat and vomiting. Also, his extremities are calm. So these are the things that you can correlate with the associated features. So these were the 10 questions that you have to ask a patient who has a symptom of pain, and then you will come more closer to the diagnosis of that disease. So this was all about today's video. Hope you have gained some knowledge. We'll be back again with some new content and some new videos. Stay tuned. Let's learn together.